Raise your hand if you've ever had a UTI. They're a real bummer, aren't they? Not only are urinary tract infections annoying, but when they become chronic, they can set off all kinds of long-term consequences that none of us have time for. Keep watching to explore science-based strategies for breaking out of a UTI spiral using natural remedies. Did you know that between 50 and 60% of women will experience a UTI or urinary tract infection in their lifetime? They are the most common bacterial infection in the world. While typically not super dangerous if treated promptly, UTIs are no fun. You've got the often intense burning with urination, a sense of urgency, and feeling like you have to pee all the time, even if you just went and hardly anything comes up. UTIs can also cause abdominal pain, back pain, and if not addressed in a timely manner, can progress to something more serious like a kidney infection. Typically, UTIs can be resolved with a simple round of antibiotics, or sometimes more natural agents like DMannose, Cranberry, or personal hygiene changes like wearing more breathable underwear, peeing right after sex, and staying more hydrated can do the trick. But a good many gals get stuck in a cycle of UTIs where they just don't stay away. According to one study, about 26% of women have a recurrence during the 6 months after treatment for their initial UTI. And in a different study, 53% of women aged more than 55 years and 36% of younger women reported a recurrence within 1 year after their first UTI was treated. I was talking to a client the other day who told me that when she contacted her primary care doctor after having 2 UTIs in 2 months and getting little relief from her round of antibiotics, her doctor told her to see a gynecologist. Upon calling to schedule with the gyno that she was recommended, the receptionist informed her that we don't treat UTIs here and refused to make her an appointment. Talk about frustrating. What a facepalm. This is just one real-life example of how difficult it can be to find lasting root cause solutions for recurring urinary tract infections. One of the tricky things about treating UTIs with antibiotics is that it frequently creates an environment that's particularly welcoming to yeast. So, once the UTI is gone, you can end up with an itchy, irritating, discharge-producing vaginal yeast infection. Ugh. Then, you're told to treat the yeast infection with the messy over-the-counter creams or suppository, only to end up with another UTI. It's just not fair, or okay, or conducive to being a productive member of society because you're always cursing your life in the bathroom instead of living it. I've met women who have been stuck on this hellish UTI merry-go-round for literal years of their life. Yes, years with no real solution. While there are many factors that help create an environment where recurrent UTIs become a problem, and everyone's different, I wanted to share some of my go-to strategies for helping women break the UTI cycle using evidence-based, functional medicine approved lifestyle changes and specific nutraceutical support. But before we get too far into this, know that I will link to the specific suggestions in the show notes for you, so no need to worry. Strategy number 1 is to ditch your synthetic lace undies. They might be pretty, but they often just don't breathe the way that they should. Instead, opt for undies made from cotton or specifically moisture-wicking fabrics. The goal is to stay nice and dry down there so bacteria and yeast don't have a friendly environment for growth. Second on the list is hydration. 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 If you're not flushing your urinary tract frequently enough, you're asking for unwelcome bacterial colonization of your underparts. Same goes for holding a full bladder for hours on end. Like we're taught from a very young age, it's important to take frequent enough potty breaks. Speaking of urination, it's crucial for women to pee after sexual activity. Right away, every time. It might be inconvenient and unsexy, but it's a must. The introduction of foreign microbes during intimacy is a well-established trigger for repeat UTIs. But again, flushing the urinary tract helps clear out any unfamiliar bugs. Our fourth strategy involves a specific strain of probiotic containing Lactobacillus rhamnosus GR1 and Lactobacillus reuteri RC14. These strains of bacteria are shown to help maintain a healthy microbial balance in the urogenital and vaginal tissue. This probiotic has been an absolute game changer for my patients over the years because it can be used as a short-term nip that UTI in the bud sort of solution, but more importantly, taking it long-term helps prevent the vicious cycle of UTIs and vaginal infections that can happen if an antibiotic is needed. Fifth, support your body's ability to kill unfriendly bacteria with allicin and allinase enzyme, a concentrated extract of garlic with well-established antimicrobial properties. The beauty of allicin is that it won't wreck your gut like certain antibiotics, but it does wonders to knock down the overgrowth that leads up to infection. Some of my clients with chronic bladder issues take one a day for prevention, and there are loads of other bonus benefits to regular consumption of concentrated garlic extract as well. Speaking of extracts, consider adding DMannose and Cranberry extract. Both of these guys are well known for supporting a healthy biofilm, which is where your happy microbes live, and they've been studied in combination for their role in both symptom relief and helping clear unwanted bacteria from the urinary tract. That's right, there is something to all of that drink cranberry juice advice. But unfortunately, most cranberry juice has so much added sugar that it's more harmful than helpful. My advice is to go with a concentrated extract instead. Another plant-based strategy with lots of research behind it is UVA Ursi Leaf extract. This well-known herb has astringent and antimicrobial actions on the lining of the urinary tract. My favorite blend combines it with berberine, which is a broadly acting antimicrobial with anti-inflammatory properties too. Waking up with yet another UTI or yeast infection is the actual worst, but these strategies can help. Be sure to check out my favorite versions of these UTI busters at the link in the video description. Pro tip, it's really nice to have some of these on hand because when you need it, you really need it. Get what I'm saying? You're welcome to take advantage of 20% off if you order through my full script dispensary. Just follow the link in the description, create your account using your name and email, and shop the catalog for whatever you need. Let me know if you need help finding anything. Just leave me a comment here and we'll figure it out together. I hope you found this information helpful. If so, please consider hitting that thumbs up button and be sure to subscribe to my channel. There's more functional medicine goodness where this came from. Thanks so much for tuning in, and we'll see you again soon.